Welcome to the Spirit of a Badass, where we celebrate stories of courage, hope, and resiliency. I am your host, Alecia Jacobson. Hello. How are we today? I have two guests with me today. You won't be able to see this, but I have my daughter, who is 8, my youngest, a little TT. It's a turtle. She takes this turtle with her to school and apparently has been told she can no longer have this turtle. So I have to document the day with this turtle today. And I am not, you all know that I am not this person where I'm just very like matter of fact in things. And this turtle came to the gym with me this morning. I have pictures of me bench pressing with this turtle. So I will be showing this part of this clip to my daughter so that she can see that her TT turtle made an appearance in this podcast. So in addition to my fabulous guest that I actually have today, we have a little turtle joining us. So that is the mom that I am. I talked about bringing joy and spontaneity and fun. And today he is my fun. So yay, me. So how are we? I am doing like, I think I mentioned a couple weeks ago, everybody has this like renewed energy, which is super weird for this time of year, but I am going to harness this and take it as far as I can. So I hope that if you also are feeling this sort of big energy to just get shit done, that you just hold on to that. It feels like one of those, like the wind thing that sort of like takes it. I don't know what that is because I don't know what it is. Anyway, I'm going off on something, but it feels very like pulling type energy. So I'm really jazzed about that. So I have a just wonderful guest with me today, and it's things that I am super interested in, and I am excited to learn about it right along with you because women's health, I mean, obviously, you know that this is what I support people with all day long, and I am constantly referring out and trying to provide resources for women to feel better and feel really good so that we can harness the good energy and be taking care of ourselves so that we can live just a wonderful life. And then also, you know, take care of all the humans that are around us that we are in charge of taking care of. So I am just super excited to introduce you today to Tracy Hammerstrom. She is a licensed acupuncturist and co-owner of Isthmus Wellness, an acupuncture and massage clinic on Madison's West Side, also offering supplemental therapies like infrared sauna, pulsed electromagnetic field therapy, and halo therapy. Tracy began functional medicine testing about 5 years ago with a GI map stool test, inspired by how it helped her and the clarity that comes with seeing specific test results. She then expanded her education to the Dutch hormone test in 2025, seeking to have more tools to help women understand why they are experiencing the hormonal symptoms that they're experiencing and guiding them towards balance with supplements, herbs, and lifestyle adjustments. Welcome, Tracy.
Thank you.
Yeah.
Thanks for having me.
That is quite the bio. I mean, your bio to me is like fangirl. All of the information that you house in your mind. I've said so many times, I wish I had a more science mind. Mine is more like, tell me how you feel and let's talk about your emotions. But I love this stuff so much. So I am really excited not only to be able to ask you these questions and have you share it, but for every single person listening to be able to be a little sponge for this, you know, next 40 minutes with you because you have such valuable information and the years of experience working with people that I'm just delighted to share.
Thank you. I'm excited to be here.
Tell us a little bit about, I've never actually talked to anybody about acupuncture on here, and I am a big fan of acupuncture, and I do not understand it one bit. I just know that I feel so good when I do it. So share a little bit about that and how that can be, because it's one thing I tell people, go get acupuncture. I don't know what it does, but I know that it's helpful. So share a little bit about that and why do I feel so good after doing it?
Yeah, acupuncture. Yeah, I mean, I think I'm biased because I'm an acupuncturist, but I also absolutely love it. And I think everyone should be getting it. I feel like if everyone had acupuncture once a week, there would be world peace. But unfortunately, access and knowing about it.
I said I'm also very mouthy on this podcast. I haven't had a mouthy one in a while. Tell us, what does you mean by that? When you say if everybody had it once a week, there would be world peace. What does that mean?
I just think it just helps to even things out. I mean, and it helps so much. I mean, maybe if anyone has heard anything about acupuncture and not had it, maybe they think about using it for pain. Like, I think that's probably what the public most perceives that acupuncture would be used for, but it also helps so much with the emotions, and it helps to unstuck things in your body, unstick things. So, whatever it is that causes people to create conflict or to feel unpleasant feelings towards other people, I think it would help to balance those things out eventually.
And
Um,
how? Because so I
yeah,
haven't had it in a while, and actually you're kind of reminding me that, hey, it would be helpful. But
yeah.
I have seen the same woman for, gosh, this stuffed animal that I have today. I saw her once a week when I was pregnant with the owner of
Oh,
TT here. So 9 years,
yes,
I've been 9-10 years.
lovely.
And actually it was my friend who was seeing her, Gladys, who was my acupuncturist. My friend was seeing her, and she called me from her office because I was about to start some like antidepressants, because I was like, I don't know what's wrong with me. And I don't feel right. And I also don't feel like I have a whole lot of time to put into my mental health right now, because I had just opened the gym and everything was crazy. And so she called me from her office and she's like, I'm setting you up an appointment now. You're going to come in here. And I saw her very consistently. And now usually I'll call and she doesn't usually answer the phone. I leave a message, and my message is usually, hey, Gladys, you're going to have to bail me out of jail if you can't get me in quickly. So get me in now. So I get, like, when you say the world peace, I didn't realize that this was not somehow, because I am funny with it, but I didn't realize that this was across the board. This is the vibe that people get, because I feel so much more at ease in my own skin. What is happening?
Yeah, I mean, let's see. What is happening?
Like the
In a
very
nutshell.
condensed, easy version of what is
Yes.
happening.
Yeah. I like to think of it as your body is a network, or like it's a circuit board, let's say. And acupuncture helps to just smooth out the circuits. So, when you're on the circuit board, like maybe too much energy is going to this way and not enough is getting down here. It's like it's not evened out. It's like there's too much over here, it's all blocked. And then over here, there's like it's getting starved because it's all over here. And so we put the needles in and it helps to smooth all that out.
Okay. That makes a lot of sense.
And like you can kind of think of that network board stuff. I mean, I referred to it as energy, so to speak. Like, yeah, so there's too much, it's stuck up here. And like that energy, so to speak, could be thought of as a metaphor for things like all of the verbs in our body, actually. I like to think of chi as like the verbs, it's the activities of the body. And the activities and the verbs are things that we don't see. We might see the result of them or we see the process of them, but we don't see verbs, right? So you can think about, chi as being like the verbs of your body. And so emotions are going to be more on the chi side of things. And, that is one of the things that most easily gets stuck in our bodies is just like anytime something doesn't go the way we expect, chi is getting a little stuck somewhere. And so, like you said, how you feel more at ease after a session, it's because it's helping to unstick it and you just feel more go with the flow. And so that's what we're always trying to facilitate is more go with the flow. And, we're kind of talking more about the chi and the emotional aspect of it, but the same thing would apply more to the physical or the noun aspect of the body as well. So like if you get an injury and you literally have, a bruise, that's literally blood that's stuck beneath the vessels or beneath the skin. And so that's some physical stuff. That's a noun that you can see, and you can see the stuckness. So acupuncture can help with that as well. In my view, in Chinese medicine, acupuncture is just one part of the equation. We also do a lot of herbal medicine as well. And so in some ways, I look at the two of them quite equally. Unfortunately, I think in the West, it's not seen as the two of them as being just as equal. But the acupuncture part of the medicine really helps to move the chi and address chi issues, verb issues more. And then herbal medicine tends to help more of the noun issues more, but they both help each other. But like acupuncture addresses those maybe a little more strongly, but it eventually does and can, and, does change those noun problems. But then also conversely, the herbal medicine addresses the noun problems, but it does certainly help the chi problems as well. So the two of them together
Yeah.
move mountains.
It's like
Just
magic.
about.
I mean, I felt so, I can't even explain to you how unwell I mean, I'm sure that you see this all the time. I felt so unwell. And I actually think I have right behind me. Yeah. I've got my herbal medicine book right behind me.
Oh, nice.
Long time ago, this was, gosh, so my oldest is 18 now. Was he born? I think he was 1. I took locally here at Willie Street Co-op before there was another one. I took an herbal, like making tinctures, learning about the herbs and then learning to make the tinctures.
Very cool.
So I have a little bit of I have a lot of tinctures around my house and a lot of like marshmallow root, like you name it, I probably have it. I don't use it as frequently as I used to, but I love it so much because I have seen it work for me, my kids. I mean, especially when they were little, I swung more, like if there was a pendulum, I swung way farther with my first 2. Were blended and I have a second batch of younger ones with a stuffed animal here. But my bigger ones, I mean, everything I used to use with them, the herbal medicine, and it's so powerful. And I think there's, that's funny. I have a little apothecary something here a seed chest my husband got me. I love, it's like, I kind of forget about this stuff, but I'm like, well, it's winter now. I can't plant it, but you can weave it in so nicely with your kind of standard medicine things that you do, because I think there is a place for everything. And I really think learning more from someone like you and having it in working with someone, because I don't think people realize what their bodies are actually capable of when they support it in this manner. How do you see, let's say a woman comes in, and because I know that you work with, hormones and things like that. And that's kind of where I want to drive this to. How do you work with somebody who comes in with we'll just go with like the typical symptoms where it's just this kind of maybe agitation, lack of sleep. I'm not feeling myself. I feel a little crazy, weight gain, things like that, where it's like, I'm not right in my body.
Yeah.
Where do you start?
Yeah. Well, acupuncture will probably do a lot because a piece of that, without doing a full workup, but just kind of like the most common thing that I would see with that kind of presentation, there's probably some, what we would call liver qi stagnation. So some stuckness where the root of it is related to the liver and emotions, probably a high stress lifestyle, things like that. And so, yeah, I mean, getting that person to be able to relax on the table as much, as deeply as possible. I think a lot of us have forgotten how to relax and how to let go and how to just,
yes.
how to just be. We're always running and doing, and we're being verbs all day long. And then it flows over into the nighttime and we don't sleep because we're just on all the time. So just kind of going with the same analogy, just trying to help them, relax as much as possible on the table, try to let go. I will often work on deep abdominal breathing with people on the table to start, because I could see that they're not breathing in their belly. Just try to relearn how to breathe properly. And so that's something then they could take home and practice, and that will help immensely. But yeah, just regardless of the points, because the points are going to move chi no matter what. They're going to help to move some of that stuckness no matter what. And then I try to work with the breath and get them as relaxed as possible on the table. Herb wise, there's, a really common kind of stress related formula called Xiaoyasan. That's probably the most used Chinese herbal formula in the country. And it translates to free and easy wanderer in English. And so I know, who doesn't want to feel that?
Like every woman in their 30s and probably over 30, like, yes, please.
Yes. Yeah. So like, that's a really common one that we'll use. If there's more heat signs, we'll use a modification of it. And then there's other things too, like, there's other herbs that I'm using outside of the Chinese medicine tradition as well. So like chaste tree or vitex is a really common one to use in perimenopause. And it just helps to regulate cycles. It supports progesterone. And so that one, it actually is a Chinese herb, but like it's also used in, Western herbalism as well, just as a standalone herb by itself for this reason. So That's one that we use a lot. And then certainly in terms of like thinking about women's health, I mean, at Isthmus, we use a ton of supplements, and we prescribe a lot of supplements, and probably all of us use a lot of supplements as well and experiment on ourselves a ton. So, we all get a firsthand experience, like, what does this do in the body? And then we use them on our patients. And, and then we have a text thread that we're always sharing pearls with each other, asking questions, and it's very lively. So, we start to see like, oh, this is really working for this. Like they said, it was going to. And so, there's various supplements that we use to help with certain symptoms that women might be experiencing like in the perimenopause time frame. And then certainly for stress and mood stuff and that sort of thing, again, I would fall back on herbs or things like L-theanine. There's combinations. I find a lot of success with some of those as well.
Yeah. What does it look like when somebody comes in? What does that process look like?
Yeah. So when someone comes to us for the first time to see an acupuncturist, it's a 90-minute appointment at least. And it starts out with an intake and history taking, at least 30 minutes, maybe 45 minutes, depending on the person and what they have going on. And so they've already completed some paperwork, but then we also ask additional questions. And like there are some traditional Chinese, intake questions that you would take called the 10 questions. And so it talks about these things that people usually never think about, like thirst, or, we'll ask details about, your urination or your bowel movements or your appetite, sweating. Like, are you sweating when you wouldn't expect to be? Are you never sweating? Things like that. And so we ask all these zillions of questions. And then together, all of those things create a pattern. I guess I should say we also look at the tongue and feel the pulses on the wrists. And so all of those things together make a pattern. And so in Chinese medicine, one of the really unique things about it is that it's based on pattern diagnosis and not just your symptom, like all back pain equals X. No way. Back pain could be 18 different things that are causing it at the root cause based on our examination and intake. So we're making a differentiation based on patterns. And so it's like, maybe the back pain person also has frequent urination and fatigue and, pale skin and some other things, right? And so all of those things together, along with like a certain tongue and a certain pulse pattern, will show that it's, kidney qi deficiency causing low back pain or something like that, just as an example.
Yeah, that's fascinating. Can you tell me, I want to stick out my tongue for you. I'm not going to. Right now, can you please tell me what it is that you are looking for? Because I think we are so used to standard, medicine. You get your 20 minutes in with your practitioner, and I have all the love for the practitioners. Everybody knows this. However, this system, I believe, is so broken and so backwards, and they don't really have an understanding unless they've gone down this path before of what it can actually be like to be seen and heard and asked questions that they would never think, like, why are you looking at my tongue? And I'm like, what exactly are you looking for on the tongue?
On the tongue. Yes. A number of things. Like, I explain to people both kind of the more anatomical things that we're looking for, but then also from a Chinese medicine perspective, what we're looking for, because all of those things are applicable and apply. So like, first of all, your muscle is a tongue. And so, I'm sorry, your muscle is a tongue.
I fully understood that your tongue is a muscle. 100%. I speak inside out and backwards fluently.
Yes, your tongue is a muscle. And so when you stick out your tongue, I can see this muscle, and we could tell a bit about like how well vascularized you are. So if it's really pale, I might think, oh, this person is a little blood deficient, or circulation isn't getting everywhere it needs to go as adequately. And then it's also the start of your digestive tract. And so it can tell us things about what's going on farther down your digestive tract. So we're looking for things like the coating, the color of the coating, the color of the tongue body, whether there's cracks or divots, the shape, whether it's really taut or it's really kind of flabby, or, all of these things have associations with different things in Chinese medicine. And so again, we're not taking it all by itself, but we're putting it together with everything that we're intaking. And then from a Chinese medicine standpoint, beyond looking at the coding and the fluids and all these other things, there's also a map of the body on the tongue. So all of the organs are mapped on the tongue. It's a microsystem of the body on the tongue.
Dang, the more you know.
Yeah. And similar thing, like this microsystem applies also to the ears. If you've ever had acupuncture in the ears, like there's a whole map of the body on the ear. And so if we needle ear points in your treatment, a lot of times it's like a way of creating redundancy in the treatment by communicating to your brain in an additional way that this is what we're focusing on this session, working on the liver or whatever it is.
Yeah.
Yeah. And then in the pulses, similar thing, that it's a microsystem for the organs. Each place is a different position.
Oh my gosh. Like seriously, so fascinating. I knew a couple of those things about the tongue, but that is just so cool. All from your tongue.
Mm-hmm.
Do you just want to look at people's tongues? Like sometimes I would look at people, like when I did, training and things like that, you can see somebody walk and I can be like, oh, I know that there's this, or you can see I would or like running or things like that. Like, oh, I know this. And you can look at somebody's tongue and be like, oh, I mean, you say, you connect these dots, but I'm sure there's information that you can gather just by a little. That's so cool.
For sure.
Our bodies are amazing. Our bodies are amazing.
Mm-hmm.
Okay. So you said it's the beginning of the digestive tract and you do a GI kind of mapping. What was that? Yes. So what is that? People will be like, oh, I know TMI, and they start talking about poop. And I'm like, oh no, girl, that is not TMI. Poop is important. It's so important. And talking about it is important. And if there's anything irregular or this or that, it is so important to bring that to the forefront because it gives you so much information about your body. So tell us about this, because I think this is a really important thing that one kind of the whole peeling away the TMI thing. I mean, we should all be talking about poop.
Totally. Mm-hmm. Yeah. And in Chinese medicine, we do talk about poop quite a lot.
Yes.
Because again, like similar to, I can look at your tongue and it tells us about, clues of what might be going on farther down. Like poop is actually coming from the body. If you look at it and tell me what you see, we can tell a fair amount. We'll ask about, is there mucus or blood? Certainly, is there undigested food? Does it take a lot to clean up when you go to the bathroom? Do you have to strain? Is it in pieces or is it formed? Is it floating? Is it sinking? So yeah, there's a lot of information you can get from the food if we just pay attention.
If you're having some weird things happen, just know that is information to look into, please. Yeah. Because too often I hear TMI, which tells me, and people, I am a safe space for the people. People tell me all sorts of people tell me all sorts of things. So I know if you're telling me and you're prefacing it with TMI, you're likely not talking about this anywhere else. So to all of you, have any weird stool stuff, please go into this a little bit more. So what is the GI map test, the stool test?
So it is a stool test and it is pretty darn comprehensive. It measures your good gut bacteria and what the populations are like. It tells you about opportunistic bacteria that we don't want there and the levels that they're at. And so it can tell us, like, some of them, it's okay if they're there as long as they're in low levels. But one of the special things about the GI map is that it's a very accurate test. So it actually counts how many are in the gram of stool. And so you actually get a number. It's a quantitative PCR. So if we remember from COVID, that PCR is like a really sensitive test. And then the quantitative part of it refers to the fact that it counts exactly how many are in there. And so it also measures like H. pylori, a bacteria that can live in the stomach and cause issues. It measures some of your digestive markers. So your pancreatic enzyme production, how well you're digesting fats. It tells, like, there's a couple inflammatory markers on there. So like digestive inflammation, like colon inflammation mostly. And then a couple of immune system markers. So it can tell us if you're having an immune system reaction in the gut. So whether you're reacting to food that you're eating or, because there's an infection going on. And then it also measures things like parasites, worms, amoeba, fungi, and yeast. Yeah. So it's very comprehensive, and people usually get some explanation for what it is they're experiencing, which doesn't necessarily have to be digestive. Actually, it could be used for a lot of different health issues that people have going on.
And you had said that you had used this and it was really helpful for you. Why did you use it, and what information did you find?
Yeah, I had it done years ago. Well, and I've repeated it a couple times as well, just to kind of see the progress of my treatments. But I had it done when I had gone on a long trip overseas through Asia, and I had a whole host of digestive issues from that trip. And part of it was related to, I had been taking antibiotics prophylactically, preventatively for malaria in different places. And at that point, this is before I got into health and medicine at all. And so I didn't know what I was doing. I didn't know I was totally wrecking my defense system. And then being over there, even though we try very carefully to avoid, water and things like that, I must have still been exposed. And plus just getting rid of all of my bacteria, my microbiome, I ended up with parasites and giardia and candida and all sorts of things. So the GI map helped me to discover that stuff and to be treated for it. And that was back when I was in school out west. And then a few years later, things were calmer and better, significantly better, but still had some things going on that I wasn't sure about. So I repeated it, got a little more detail about what was still going on, and was able to treat the rest of it. So it was hugely, hugely helpful for me just to know exactly what was going on in my gut. And then how to target it.
Mm-hmm. Mm-hmm. What sort of things, what would someone say to you, or what maybe symptoms would they bring, or might they be experiencing that you would think and say, okay, I think this would be good? Or is this if you have a pulse, this is a good thing for you? Because I feel like some things are like that.
Yeah, just about like that, actually. Okay. I mean, the thing is, I would say, if someone doesn't have much going on, if they feel pretty good, you probably don't need to do it. Because honestly, in these tests, there's probably going to be, no one's going to have a perfect test either. That's something else. So if you really are in some kind of superhuman great health, then you probably don't need to run it, because we don't need to treat what you don't have a problem with, right?
Yeah.
But for sure, obviously, anyone who has digestive issues going on, whether it's an IBS kind of presentation, whether it's a GERD or reflux kind of presentation, whether it's chronic loose stool or chronic constipation, or just GI pain. Definitely had people with just random pain.
You mean if I eat and immediately have a stomach ache almost 100% of the time after eating, I should probably do something like that?
Absolutely. Absolutely.
My poor husband. I'm like, oh, my stomach. I'm not even messing with you. Mm. Just my stomach all of the time is so, and it's interesting. I could eat the same thing in the morning versus at night. And at night I'll have a stomach ache from it. In the morning I will not. Uh-huh. So that's a fun thing too. So this is, I don't know that I have heard about this in any sort of way that you have shared it. So I really appreciate it, because I think that's why I said anybody with a pulse, because after you were saying, here are all the things that can help, I'm like, oh, yes. These are all things that I hear all the time. Now, what would treatment, you said, you did your treatment. I'm sure, you help people with their treatment for it. What does that look like? And obviously there's a whole host of things that it supports, but what does a treatment plan look like?
That's a good question, because that's definitely something when people are interested in it and we do a discovery call, I need to warn you, this is what the treatment's going to be like too. So if you don't want to go through with that, then we might as well not go forward. Right.
Yeah.
I mean, it's usually pretty supplement heavy, right? It can be. And certainly I'll work with within the means of whoever I'm working with, in terms of how many pills can you handle? How much can you afford? because certainly there's different ways of ordering the treatment, so to speak. Like if you really can't do everything at once, well, we can just do it in steps or stages. But besides that, there will be, usually we will talk about diet to some extent. I mean, and it's not always obvious that there's something dietarily that can be adjusted, but usually for most folks, there's something. And whether it's getting more fiber in the diet or more, polyphenols or, brightly colored fruits and vegetables, things like that, it could be just more of an anti-inflammatory diet for a while we work on things, things like that. So certainly dietarily, for some folks, it's more lifestyle. Like certainly stress can make certain things in the gut worse. And so, if they report that stress is a big issue for them, certainly that may be something we need to work on as well at the same time. And then lifestyle as well. I mean, like for some folks, if they have something like leaky gut or constipation or things like that, sometimes, not snacking between meals can make a really big difference, because it when you eat between meals, it can reset the migrating motor complex, and like food can get kind of that action that pushes food down from the top to the bottom can stop, and things can stagnate in places they're not supposed to. And and like, if there's a propensity for that, like we can just ferment there and tell them. So, and that maybe is the ideal. And obviously, like some people need to snack or it's just habit, but it won't affect everyone the same way. But for some folks, that's going to make a big difference.
Yeah. That's interesting. I was in my workout today and I'm doing these like wall ball exercises, and I stopped and I was like, I really wish I had a snack right now. I love it.
And that's, if your body's asking for it, it's probably, and you're working out.
I know. And it's like, oh, maybe you should have eaten breakfast before. But I know that there are, that's interesting because you started saying is sometimes there are things that you wouldn't really know, because who would have thought? I mean, obviously if the snacks you're choosing are, a certain way or something, but if they're just regular snacks, I don't think many people would have an idea that, that natural function of pushing down might be kind of restarting, like you said. That's so interesting. Our bodies are, I wish I had space to retain. I just extract it from other people, but it's so fascinating. That's so fascinating. All right. Let's get to the Dutch test, which is one that I've listened to a few things on the Dutch test. I think, like I said, when I reached out to you, I have recommended it to a good amount of women over the last probably 5 years. And 100% of the time when I say, have you ever heard of the Dutch test? 100% of the time, the answer is, what is that? No, I have not. So I'm really excited for you to share what, this new thing that you're offering is, because I think it can be so supportive and helpful. And I'm sure that's why you're bringing it to your practice, and giving people sort of the intro to what it is so they can see if this would be a good fit for them, because I feel like it's not widely spoken about, and there's not a lot of information that I think is just out there to the general public, really.
Yeah.
So kind of what made you get into it? Who is it for? And then we can kind of meander from there.
Sure. So I became interested in it this year, and we started offering it this year. Earlier in the year, I did a functional medicine program on dermatology. It was like a dermatology specialist kind of thing. And kind of to go back to the GI map, one of the main things that I was taught in that is that for any dermatological condition that someone comes in for, GI map, absolutely. Like they have to do it. It's coming from the gut. So that's like another major thing that people should consider a stool test for.
Yeah. And that's a huge thing we found that out with my youngest. This little TT is making I talk about her a lot today, apparently, my youngest. She had an egg allergy and we did not know it. And when she was, I think, 4 months old, she had just eczema covering her whole body. And I don't think people have an understanding how much their gut is connected to literally everything in your body.
Absolutely. Yeah. So I did this dermatology class everyone gets a GI map. But that's where I learned about the Dutch test, because certainly for some of the acne cases and some of the other ones, she would pull a Dutch test. And so she did a whole, did a whole module on it, and I got to see lots of cases with it. And that's where I got really interested in it, because we do see in our clinic, a majority of our clientele are women. And so we work with a lot of women's health issues, and many of us are getting to the age where we're approaching perimenopause. So we're all talking about it. Everyone's talking about it, right? In the ethers. I know.
Thank God. I mean, now, yeah. And now we just need, like, you're going out and getting the answers, which is so delightful, because yes, everybody is, there's not one day that goes by that I don't have a client saying the word menopause, perimenopause, testing, need to make an appointment, like
absolutely
every day.
Yes. And so it was, so as I started learning more about that after the course, and I have another couple of colleagues who were very interested in it as well. So we all decided to like band up together, and, all this year, the test we've been doing is like, we're actually going over all the results together. So we're putting two heads on everyone's case, and we're learning so much. It's been so fascinating. So yeah, because we see so many women, there's just such a need for it. And like I said before, like, it's just so nice to have test results that tell you exactly what's going on.
Yeah. And what does Dutch, because it's an acronym, so what does Dutch stand for?
Yeah, it stands for Dried Urine Test of Comprehensive Hormones.
Okay. And what does that mean?
Yeah. So it's a urine test. So it's very easy to do at home. You get the test kit, you follow directions, you do it at home over a 24-hour period. So it's not just taking one snapshot, it is doing it over a 24-hour period, which is nice. And then it's measuring your sex hormones, your androgens, so things like testosterone and related hormones. And it's measuring your cortisol throughout that day. And it measures melatonin. It measures some organic acids. So some of those are measuring things like nutritional status and inflammation. Part of the thing that's, a lot of people ask about with hormone testing is like, how relevant is it? Because it's just like, you take it one day, what's the big deal, right? And so certainly there is, depending on the person, like if you're a cycling female, it is preferable to take it between days 18 and 22. And so you do have to do some counting and timing depending on the length of your cycle. If you're not a cycling female, you could take it any time. But the thing that's a little bit different about the Dutch is that it's not just measuring those hormones. It's actually measuring also the metabolites of those hormones. So like the kind of the chemical markers that give evidence of that hormone having been there, if that makes sense. And so it's kind of measuring more of a verb or a process as opposed to just like a snapshot.
Mm-hmm. And
so it's more like getting a measurement of like a whole, it's more like you're getting a whole movie as opposed to just a picture.
Oh yeah. I like that analogy. Okay. So perimenopausal woman, I come in, I do the Dutch test. What happens next? You get the result. Now you have to read it, correct? This isn't just something where it's like you have to have training in reading. This isn't something like, sometimes I'll get results back and I like screenshot it and put it in Google or ChatGPT and like, what does this mean? Or I send it to my medical friend, but you actually have to be trained in reading the Dutch test. So this isn't just something that anybody can do.
It is very complicated. Mm-hmm. Yeah. It's a very complicated test result. I mean, I would, they're all kind of complicated. I mean, the GI map is complicated too, but the Dutch is like even more complicated. And part of it is like, if you think about all of these things, like your hormones don't just exist in a silo. That's why it's so complicated. Mm-hmm. It's the relationships and the patterns and being able to pull out those things is what makes it more complicated.
Yeah. When it comes to this and probably connecting it to other things that you're doing, what patterns are you looking for?
Yeah, certainly one of the super useful things about it is looking at the cortisol for the day. And so how well are they handling stress? And are they stress? Or are their adrenals already kind of tired from handling stress for so long? And so that will give us a better idea of how to support them. And certainly that stress piece of it, the cortisol piece, can be a bit of the root of of some of the other results that are there, because it can kind of rob resources, steal resources from the other hormones, so to
Oh,
speak.
will you speak on that a
Hmm.
little bit, please?
Yeah, well, just that in the way that hormones are kind of differentiated in the body, there's this whole cascade. Like it starts at the top from like a cholesterol molecule, and it goes into pregnenolone, and then from pregnenolone it goes into DHEA, or it goes into progesterone, and then from DHEA it goes into testosterone or estrogen, and then from there. And so there's all this
Yeah.
differentiation, like this cascade. But when your adrenals are needing to make cortisol because of stress, it thinks it's under threat and running from the tiger. And just even if it's just chronic every day, like going to work, it's robbing some of those resources from being able to make the sex hormones, because it's all coming from the same kind of substituent.
Yeah.
I don't know.
It's all right. We
So,
can just make words up around here too. It's
all
fine.
right, perfect.
I mean, clearly I'm doing it. Wow. Okay. So it's not just the stress, because when a lot of times, we think about stress, that's a lot of the work that I do is supporting women in their work life, and how can we put stress reducing things in, and I hate the word balance, but how can we create some sort of container where you're not having the impact of stress and all the things that come with it. So you're
Mhm.
saying when the cortisol gets kind of overloaded, the
Mhm.
resources that go from other things, kind of, it reminds me of like, so today I'm at the gym and I'm trying to do the bench press, like I had said earlier. And I could not I did a little bit heavier than normal, but I was like, oh girl, you got to take this from me, the trainer, because yesterday I was doing super heavy lifting. And so today my body could not do the same thing that it could do yesterday. So if you're extremely stressed, your body can then not make the other things that it would be making to support your body. So in addition to the overload of cortisol, you are going to
Mhm.
have other things not being done properly because that is
Mhm.
taking the resources.
Mhm. Yeah. And if you think about it from like an evolutionary standpoint, when our bodies are under stress, there's not enough, like why would we be making babies? Yeah. It comes down to that. So there's just, that's not where the body's resources are going.
Yeah, they're going someplace else.
Yeah.
Now, is that directly, because I'm thinking you hear, high cortisol, weight retention and weight gain. Is
Hmm.
that kind of what you're talking about? Similar
Hmm.
there? Okay.
Hmm. Yeah. Yeah. There's a whole constellation of, I mean, with any of the kind of patterns that can come out on the Dutch test, there's a constellation of symptoms. But of course, again, like with Chinese medicine, we map it back to what the person's actually experiencing
Yeah.
as well.
Is the
Yeah.
Dutch test, is that connected to Chinese medicine? No. Are
No,
you
not
able,
directly.
okay, but are you able then, when you're using it, to then support it with Chinese medicine? Oh, I
Absolutely.
love that.
Because, like it all comes down to patterns. It's like the thing, with both of these tests, the GMAP and the Dutch, they both have patterns. Like if this marker is high and this one's low and this one's low, that's more or less representative of leaky gut. Well, leaky gut looks like spleen chi deficiency to me, and with potential dampness overflowing. So, you know, same thing with Dutch, like you can see, what's a good example of like low, like testosterone and low estrogen is going to look like a qi or yang deficiency, more of like a yang deficiency in Chinese medicine. So like I can kind of pull resources from both disciplines and to support the person.
Yeah.
Mhm.
Oh, that's fascinating. I love this stuff. So, what do you see most often, or what did you see in your training kind of come out of the Dutch test, and how, like, what does it look like following somebody? Okay, I took the test. Here may be the most common themes
Mhm.
that come out of it. And then what happens afterwards? What do you see?
Yeah. I mean, certainly in the training I did, a number of them were related to high androgens because they were acne cases.
And can you explain what that is?
Yeah,
Ish.
it's ish. It's like, so in women, all of these hormones are supposed to be in certain ranges for us, right? And so, and both genders, both sexes have all of the hormones, right? And so for male people, it should have like certain levels of testosterone that are higher than for females and certain levels of estrogen that are lower than for females and vice versa, right? And so when like a woman has higher androgens, or even when a man has higher androgens than like the normal level, it will show up with certain symptomology like acne or hair loss or too much hair in places you don't want hair. And so that's usually what we're speaking about when we talk about androgens.
Okay.
And when we're kind of looking to optimize them, it's usually related to symptoms like that.
Okay. I have a good number of people who experience hair loss in perimenopause. Is this test something that can kind of be part of that and support that?
Yes. Yes.
Okay.
For sure. And we saw, because there was a portion of the derm class I did related to hair loss.
Oh. So looking at, what you see with the Dutch test, how will I feel better after using this tool?
Right. Of course. So kind of similar to the GI map. So our interventions are going to be lifestyle, dietary, supplements, herbs, and then, potentially acupuncture as well, just to help with stress management and even things out. And so, there's certain supplements or substances that are going to be more frequently used for, a Dutch test result versus a GI map test result, right? And so like something I mentioned earlier was like the chase tree or vitex herb is one that's used commonly, and so that can support progesterone levels or just like helping to regulate cycles so they're regular again, because that's obviously a common symptom in perimenopause. And then there's certain substances that can help support estrogen as well if we see that it's low, or it can just help to kind of even it out or help with symptoms of low estrogen, even though like in perimenopause, it could be kind of up and down. And then, certain things to help with, depending on the results, right? Like, we could supplement DHEA directly if that's what the test results show. And that's something I wouldn't do without testing. Like, I'm not comfortable doing that without seeing what the actual levels are of testosterone and estrogen. And importantly, to see how they're metabolizing estrogen, because if you're not metabolizing it, there's like a few different pathways that you metabolize estrogens into. And some of them are more desirable than others. And so it shows you the breakdown of those. And if you're not metabolizing it into a great pathway, like that's definitely something we need to address.
Yeah.
With certain supplements to help with like detoxification and help with estrogen metabolism.
Oh, so that was one of the most fascinating things when I first learned about this, was that I could go and take a standard, like I have a naturopath where I go and I'll get my labs done and it'll say like, yep, all good. And the really interesting thing I saw with the Dutch test was that you could have a reading that says green light, all good. Like so many people come back from their doctor and they're like, yep, I am normal. They say everything's fine. However, I feel like shit. Yeah. So everything is not fine. And one of that you said there's different pathways. So although the lab number comes back normal within range, it can be taking a different pathway. So your body isn't actually getting what it needs. And with this test, you can see, oh, it's going down this highway and we need it to go down this highway so that you actually feel good. So you're saying with that, you do a detoxification. Is that what happens? Ish?
Yeah. Okay. Right. Depending if it's going down the pathway that's less desirable, too much of it is going down the pathway that's less desirable. We will do detoxification things. Well, it's like supplements and things that help your body to detoxify the excess estrogen more efficiently and better. And also I should just say like that negative pathway is it's undesirable because it's something that can be associated with growth, like unwanted cell growth. So things like fibroids or cancers and things. So it's, I've actually had women, reach out to do the Dutch because they do have, cancer in like breast cancer in their family or things like that, like estrogen related cancers in their family. And they just want to see that they're detoxifying in the right pathways. So that's super helpful.
So you do the detoxification And then how does it go from, and maybe, I don't know if you know this, but how does it then stop going in the undesirable way and start going in the new pathway? How does that happen?
I mean, it kind of does. It depends on the situation. And I'm not 100% sure, to be honest, but like I know for one person that I worked with, based on their test results, they probably just need to, to take more sulforaphane, broccoli seed extract, more or less forever, with just some regularity to help with their pathways.
Okay.
And I don't think that's going to be the situation for every person, but for this particular case, the evidence showed that they just need to be having more sulforaphane in their diet.
Okay. And is it just if you detoxify it, is that helpful in sort of getting it to go the correct way?
Yes.
So fascinating.
Yeah.
And especially, I mean, when you think about, if you know that you have a trend of certain things, diseases, cancers in your family, I mean, you want to try to do everything you can to support your body from the inside out so that is not something that you have to also deal with. And I say deal with, that's so minimizing, and I don't mean it in that way. That is not like, I'm not just mean deal with. It's not like you're just dealing with like a traffic jam. So let me be very clear.
Right. And I just want to clarify too, like I don't want anyone to think that like this is your screening test for estrogen sensitive cancers. Like it's not that.
This is a tool.
It's a support.
Yes. This is like,
it's a tool.
I think lots of tools, but yeah, you have to do all of the other measures that you need to take with your healthcare provider. This is just one small slice of options that we have out there for us. Okay. Oh my gosh. Is there anything else about the Dutch test or the GI mapping that you think would be helpful for people to know if they're kind of thinking about this and like, that's so interesting, or anything that maybe you didn't share that you would like to share?
To me, like it all comes back to treating the whole person. And part of how that's done is by the patterns that emerge from, our intakes, but also the patterns that emerge from these test results that are quite comprehensive, both of the tests we talked about. And so I just, that's what we do. That's what I like to do in this medicine, is to be able to treat the whole person and not just like, oh, you have a headache, I'm going to put a needle there, or I'm going to give you ibuprofen or whatever. It's about trying to get to the root cause of why the headache's coming up in the first place. What's going on in your body you don't have enough of, or you have too much of, or like you said about the word balance, creating more balance.
Yeah. Yeah. And it kind of reminds me, I mean, I think a lot of people are out here playing like whack-a-mole. They have the headache, or then they have the backache, where if you can actually, and I feel like this also comes out of my mouth, but you have to be so intentional with it, and you have to take the time. I think, when you said, when you do an intake and people, might like, oh, that might seem too much, but I wholeheartedly, fully, with my whole being, believe you have to be too much. You have to be so intentional when it comes to your health, and you're like, this is the only vessel we get. And by treating and actually looking at the root cause. And sometimes, like I said, my friend called me from the acupuncture place because she's like, I know you're just being, and I'm not calling y'all lazy out there, but she knew me and she knew that I was just being lazy about it because I was tired. I had just had another like little kid. I just opened a business. It was like, I don't want to have to deal with my mental health right now. Like, I don't want a pill would be so much easier. And now again, like, you need this a lot of times, but she knew me. She knew that I didn't. She knew that I could treat it through different modalities. And I was just being like, giving up, saying, I don't want to. And I am so thankful because to be known like that. And I think that's a great, to your point, saying you see people and you connect you see the patterns. If you don't take that intentional time, you can't find the patterns. And so taking time and sitting down with somebody like yourself, who is like, we have 90 minutes. I'm going to ask you questions that most people would not ask you. I'm going to take time to actually, knowing that these, however many areas, your tongue, your ear, like all of these things have meaning and they can point directions. And if you really just carve out this time for yourself, and I get like, this is an investment. And I also very much have always been, even back when I was so poor and divorced and had no money and was raising 2 kids on my own, I still was doing the naturopath and the vitamins because I knew that I would not be able to do those things if well-ish.
Yeah.
I look back now and I'm like, dang girl, you screwed up a little bit, but I would have screwed up way more.
Sure. You learned
right.
From it.
Exactly. Trying, but you feel so much better in your body when you do these things. Everything that you talked about today, that's a hell yeah for me. So if you are listening to this, like go explore, go, check out if you're local. I have a lot of listeners local to Madison. Check out Isthmus Wellness. I've been in both I haven't been to, you have a location not in Madison, but I was at your one back on Junction. I did some Reiki sessions there and came in.
Oh, cool.
And then I get my supplements, some of them over at your new location. So I love what you do.
Oh, great. Great. So you've stopped by our Gammon Road location.
Oh, yes.
Oh, great.
Yes. So I'm just super excited for everything that you offer because it is so needed. And thank you for sharing just a little sliver of who you are and what you have to share, because we out here we need it so badly. And I am a person, and I know that you obviously do this, but it has like literally life-changing. Like when I tell people acupuncture, I'm like, I don't know what it does, but it changed me. It takes me from being, very stabby to I'm not going to get arrested today. Like, it's a good place to be.
That's great. What a testimonial.
You're out there saving the world. Like you said, world peace, which is, truly.
Exactly.
Yes. I fully believe that. Absolutely.
I believe it too.
Mm-hmm. All right. Thank you so much for being here.
Thank you, Alecia.
How can people, we'll have, links in the show notes, but how can people kind of learn more about you and what you offer?
Yeah, sure. The website would be the best way. So isthmuswellness.com. All of our bios are up there and ways to book appointments. And I would just say too, like if anyone is interested in talking more about one of these tests, but, just having a conversation, we do have complimentary discovery calls for these tests specifically. So you could just schedule a 15-minute phone call with me. Well, you could tell me what's going on, why you're thinking about it. And I can, give you more direction, whether we think it's good to move forward or not.
Excellent. Awesome. That's so great because I'm sure listening people are going to it's going to stir a lot more questions when they're thinking about, oh, I have this and that. Mm-hmm. Yes.
Right. And they might not know if it's related or if it would be helpful. Yeah, for sure.
Yes. Excellent. Well, thank you so much, Tracy. And then everything will be in the show notes for people to find. And I just really appreciate you sharing your expertise with us.
Well, thank you. I appreciate you.
Spirit of a Badass is a Lit Path Studios podcast and is produced by Jamie Gale and Alecia Jacobson. Music by Shane Ivers. We'll be back with another inspiring interview. Until then, keep your spirits high and your energy badass.